Hello, my name is Laurie Smith. It's nice to meet you.
Hello,
I have been looking
Laurie.
forward to
My
interview.
name is Hillary Jones. I am the Director of Medicare Services. Chronic Care Nurse Specialist. You are interviewing for today outreaches to Medicare members that have chronic health concerns and are faced with medical hardships. Laurie, why don't we start by you telling me about yourself and why you applied for the position?
I have been a nurse for over 20 years, with experience in emergency room, ICU, and Medicare restorative health. I have worked with Medicare patients for over 10 years now.
What circumstances brought you to think this job is interesting and to apply?
I have been searching for a position within the Medicare division and believed that assisting members with chronic debilitating conditions would be a rewarding career experience.
What unique experience or qualifications do you have that separates you from other candidates and prepares you for this position?
I have certifications in managed care nursing and chronic condition nurse specialist. I have worked with the Medicare Skilled Nursing and Rehabilitation Unit for over 15 years.
Thank you, Laurie. Your certifications and experiences working with Medicare patients aligns with our department's objectives. Next, let's talk about what was one of your proudest work moments. After going into detail, could you tell me why it was one of your proudest work memories?
My proudest work moment would be the 95-year-old female patient that during a case management outreach telephone call I was able to assist her affording medications. I helped her through the entire process of applying for extra income assistance, and she was able to quit her job as a Walmart greeter. It was a very fulfilling moment in my career because she no longer would need to work part-time to pay for her medications.
That is wonderful, Laurie. Our program does support the special needs of our senior Medicare patients. This situation you have described often happens for our members as well. How do you handle quickly changing priorities and staying organized when there are numerous things going on at one time and when they are often changing?
I believe in organization, and being adaptable to change helps me stay focused on the tasks at hand. Since the managed care industry is constantly evolving, change is inevitable. I also believe for processes to improve, change must be accepted and dealt with appropriately. I realize healthcare laws are constantly being reviewed and scrutinized.
Those are excellent points you have made, Laurie. Our department must adhere to strict guidelines and policies handed down by our government. What would you say is your strongest work attribute trait?
My strongest work attribute trait is that I am dependable and believe in doing the right thing even when it is not easy.
That is an excellent trait to have in this line of work. We are looking for dependable nurses who are willing to do the right thing. What would you say is your weakest attribute?
My weakest attribute is I am very hard on myself and have a hard time saying no.
You sound like a very caring person and passionate about whatever you are working on. What are your long-term goals for your career? Also, what do you hope to accomplish in the next 5 to 10 years?
My goals are to continue to evolve and grow within our company. In 5 to 10 years, I hope to accomplish a management position within the organization working on healthcare policies.
It sounds like your career objectives shows a commitment and strong dedications to the managed care industry and to our organization. Laurie, would you be willing to acquire additional managed care certifications, such as a certified professional nurse coder and a nurse case manager if you were reimbursed?
Yes, I would very much be interested in obtaining additional certifications that would assist me in performing my job more effectively and more efficiently.
Thank you, Laurie. Our case managers are expected to continue their growth in their fields of expertise. Laurie, lastly, I would like to know why you should be hired for this position. What sets you apart from other applicants?
I am self-motivated, hardworking, and dedicated to my job and organization. Also, I am a great multitasker who has proven time over time to meet tight deadlines. Also, I have a strong commitment to help patients through evidence-based practices that improve their quality of life. Therefore, I know I would be a great addition to your team.
Thank you, Laurie, for your interest in this position. Do you have any questions you would like to ask?
Yes, could you explain to me what qualifications for this position are you looking for in a candidate?
Our Medicare case managers are expected to be highly efficient in dealing with patients with severe debilitating health conditions. Current knowledge of Medicare laws and regulations for our industry, experience in health promotion and prevention areas are also a necessity in this case management role. Our case managers work independently and also function as a team. I am looking for someone to join this dynamic group and can adapt to the many changes the department faces daily.
Thank you for explaining what you are looking for in a candidate. I am very interested in this position and believe I could be a great asset to your team.
It has been a pleasure interviewing you today, Lori, for our case management nurse position. We will be making a selection in the next couple of weeks. Once the decision is finalized, you will receive a notification from our Human Resource Department. If selected, you will sign an acknowledgement statement. Thank you again for your interest.
Thank you for this opportunity to interview with you today. I am very interested in this position and will be looking forward to hearing from you soon. Thank you again.